Hello everyone, today I am going to explain you about the kidneys present in the posterior abdominal wall. See, the kidney has first upper pole, lower pole, anterior surface, posterior surface, medial border, lateral border. First we'll see the relations on the anterior surface of the kidney. Here we have upper pole, impression for the suprarenal gland, hepatic impression, duodenal impression, right colic impression and jejunal impression. Posteriorly, the kidney lies on the abdominal wall muscles, posterior abdominal wall muscles. Posteriorly, so what are the abdominal wall muscles? That is, first here is a psoas major muscle, quadratus lumborum muscle, and next transverse abdominal muscle. And nerves include subcostal nerves, iliohypogastric nerve, and ilioinguinal nerve. Much. And next on the medial side, here we will find it is related to the hilum of the kidney where blood vessels are coming. So from the anterior to posterior, first we have is a renal vein. This is a renal vein, and next is a renal artery. This is a renal artery, and next is a renal pelvis which continues as a ureter. This is called as ureter. This is all about the right side. Next we'll see on the left side on the anterior surface we have following relations. So first impressions we can see here is the gastric impression. Here is a gastric impression, here is a splenic impression, pancreatic impression, left colic impression, this is left colic impression, and here it is a jejunal impression. This is all about the relations on the anterior surface of the left kidney. That is, this is all about the posterior abdominal wall. First one is gastric impression, splenic impression, pancreatic impression, left colic impression and jejunal impression. Thank you.